Have you ever felt that sudden, intense, paralyzing pain in your leg or foot, like the muscle was twisting from the inside? What if I told you that, in some cases, that pain is much more than just a cramp? It could be your body's urgent warning, a sign that something serious is happening behind the scenes. Today we're going to uncover what's really behind muscle cramps, and why ignoring them could be a dangerous mistake. If you suffer from frequent cramps or know someone who does, go ahead and like this video, subscribe to the channel, and share it with someone who needs this information. Your support helps this content reach more people who might be suffering in silence with this painful symptom. Cramps are sudden episodes of intense pain and involuntary muscle contraction that can last just a few seconds or stretch into minutes that feel like forever. They come out of nowhere, in the middle of the night, waking you up with a stabbing pain in the calf after a simple walk, during a workout, or even while sitting comfortably. For many people, cramps are nothing more than a passing nuisance, something that goes away with a quick massage or a glass of water. But the truth is, this symptom, often brushed off, can be much more than just a random reaction from your body. In some cases, it's a silent alarm, a cry for help from a body that's trying to stay balanced but is failing, whether due to dehydration, mineral deficiency, or even hormonal or neurological dysfunctions affecting muscle health. What most people don't know, and almost no one talks about, is that cramps can be the first sign of a much deeper and more serious issue. That's because muscles are incredibly sensitive to even small changes in how the body is functioning. A slight shift in electrolyte levels, circulation problems, or a metabolic disorder, like diabetes or thyroid disease, can instantly affect how your muscles respond and behave. And instead of showing obvious signs like fever or widespread pain, your body whispers, "Something's wrong." And that whisper may come in the form of recurrent, localized, and persistent cramps. That's why in this video, we're going to reveal the 9 hidden causes of muscle cramps, explain which symptoms mean you need medical help fast, and show you what you should never do when trying to relieve the pain, so you don't put your health at risk. Pay close attention because the answers you've been looking for might completely change the way you understand these mysterious and painful episodes. The 9 causes you need to know. 1. Dehydration, the silent villain. Dehydration is without a doubt one of the most common causes of cramps and one of the most overlooked. Many people associate lack of water only with thirst or dry skin, but the effects of dehydration go far beyond what you can see. When the body is low on water, it loses its ability to maintain the delicate balance of electrolytes like sodium, potassium, calcium, and magnesium, which are essential for proper muscle function. Without this balance, the nerve impulses that control muscle movement become erratic, triggering involuntary, painful, and even paralyzing contractions. That explains why many people experience cramps after walking in the heat, during sleep, or after intense physical activity without properly rehydrating. The problem gets even worse for those who take diuretics, sweat excessively, or simply forget to hydrate throughout the day. The truth is, without enough water, your muscles literally scream for help, and cramps are that scream. Staying hydrated isn't just a wellness tip. It's a physiological necessity to keep muscles functioning properly, prevent painful spasms, and protect your body from more serious complications. 2. Thyroid dysfunction. People with hypothyroidism, meaning their body produces too little of the T3 and T4 hormones, are more likely to experience cramps. When the thyroid gland starts producing less T3, triiodothyronine, and T4, thyroxine, the entire body slows down. These hormones act like conductors in an orchestra, regulating the metabolism, but their role goes far beyond just burning calories or managing energy. They also play a key role in neuromuscular activity. When hormone levels drop, the electrical signals sent from the brain to the muscles become weak or erratic, creating poor communication between the nervous system and muscle tissue. The result? Involuntary contractions, persistent pain, stiffness, and, over time, even muscle weakness. Many people with hypothyroidism don't realize that their constant fatigue, muscle spasms, or nighttime cramps may actually have a hormonal cause. And since these symptoms often develop slowly and subtly, diagnosis can take years, all while the discomfort worsens. Recognizing this connection is essential. With proper treatment and hormone replacement, guided by an endocrinologist, it's possible not only to relieve the cramps, but also to regain balance and quality of life. 3. Poorly managed diabetes. Poorly controlled diabetes is one of the most dangerous and silent causes of cramps, affecting the body in multiple ways over time. The first mechanism happens acutely. When blood sugar levels remain high for too long, the excess glucose begins to pull water out of the cells, creating a state of cellular dehydration. This fluid loss disrupts electrolyte balance and muscle function, increasing the likelihood of sudden intense cramps. But the second mechanism is even more concerning and long-term. Chronic high glucose levels gradually damage nerve endings, a condition known as diabetic neuropathy. This complication affects the nerves responsible for muscle control and sensation, leading to frequent cramps, burning sensations, tingling, numbness, and even loss of reflexes, especially in the legs and feet. Many people with diabetes don't connect these cramps to poor blood sugar control and end up just treating the symptom without looking deeper into the cause. But these signs can be the first red flags of developing neuropathy, which, if not diagnosed and treated early, can lead to serious complications like foot ulcers, mobility issues, and decreased quality of life. So, if you have diabetes and are experiencing repeated cramps, especially at night or after light activity, talk to your doctor right away. It may be your body's way of warning you that something in your treatment plan needs to change. 4. Mineral imbalance. Potassium, sodium, calcium, and magnesium. The balance between the minerals potassium, sodium, calcium, and magnesium is essential for muscle health, and any disruption in their levels can trigger frequent and painful cramps. These minerals act as true electrical messengers in the body, responsible for transmitting the nerve impulses that control muscle contraction and relaxation. When they're out of balance, whether due to a deficiency or an excess, the signals sent to the muscles become disorganized, leading to involuntary spasms, tension, and pain. Potassium, for example, helps maintain the electrical potential across cell membranes and supports nerve conduction. Sodium regulates fluid volume in the body and directly influences muscle contraction. Calcium is crucial for proper muscle contraction, while magnesium is essential for muscle relaxation after contraction. However, many people turn to mineral supplements on their own when they experience cramps, which can be extremely dangerous. For individuals with impaired kidney function, for instance, excess potassium in the blood can lead to life-threatening cardiac arrhythmias. Too much magnesium can cause severe diarrhea, nausea, weakness, and a sudden drop in blood pressure. That's why before starting any supplementation, it's essential to get blood tests and consult a doctor. Only then can the specific mineral imbalance be identified and corrected safely and effectively, preventing not only cramps, but also more serious health complications. 5. Parathyroid disorders and calcium imbalances. The parathyroid glands regulate calcium levels in the blood. Though less common, parathyroid dysfunctions are important and often overlooked causes of persistent and unexplained cramps. The parathyroid glands are 4 small structures located behind the thyroid. They are responsible for controlling blood calcium levels, a mineral vital for both nerve signaling and muscle contraction. In hyperparathyroidism, calcium levels in the blood rise. This can cause not only cramps, but also muscle weakness, chronic fatigue, bone pain, kidney stones, and in advanced cases, bone density loss. In hypoparathyroidism, calcium levels drop, directly affecting nerves and muscles, Symptoms may include tingling in the lips, hands, feet, and face, muscle spasms, involuntary contractions, and frequent cramps. The major issue with these conditions is that the symptoms are vague, gradual, and often mistaken for more common problems like stress or poor posture, which leads many people to live with discomfort for years without a proper diagnosis. That's why in cases of recurrent cramps associated with other neuromuscular symptoms, it's essential to investigate parathyroid function and blood calcium levels through specific lab tests. Detecting this imbalance in time can prevent serious complications and bring long-lasting relief to the patient. 6. Medication use. The use of certain medications can increase the likelihood of muscle cramps. Many drugs, while essential for treating chronic conditions like high blood pressure, high cholesterol, or osteoporosis, can interfere with electrolyte balance and neuromuscular function, making patients more prone to frequent cramps. Diuretics, for example, are widely used to control blood pressure and eliminate excess fluid. However, by promoting the excretion of sodium, potassium, and magnesium through urine, they can create a mineral imbalance that directly affects muscle function. Statins, prescribed to lower cholesterol levels, may cause muscle-related side effects in some patients, including pain, weakness, and cramps, due to changes in energy production within muscle cells. Certain osteoporosis medications have also been linked to bone and muscle pain, which can resemble cramping. Even some blood pressure medications can cause subtle imbalances that manifest as muscle spasms. So if you recently started a new medication and noticed the appearance of cramps, especially at night or after light activity, it's important to talk to your doctor. In many cases, a simple change in dosage or switching to a different medication can eliminate the problem without compromising treatment of the original condition. Never stop taking a prescribed medication on your own, but also don't ignore the signs your body is giving you. They could be warning you of an adverse reaction that deserves careful attention. 7. Vascular problems. Vascular issues are a serious and often overlooked cause of cramps, especially in people over 50 or those with a history of smoking, diabetes, hypertension, or high cholesterol. When blood circulation is impaired, due to blockages, narrowed arteries, or poor blood flow, the muscles no longer receive adequate oxygen and nutrients to function properly. During physical activity, even something mild like walking, muscles demand more oxygen. But if the leg arteries are partially blocked, the body can't meet that demand. The result is a pain that feels very similar to a cramp, sudden, localized, and often accompanied by a feeling of heaviness, burning, or weakness in the legs. This condition is typical of what's called peripheral artery disease, PAD, a progressive condition where fatty plaques build up in the arteries, restricting blood flow, especially to the lower limbs. One of the hallmark signs of PAD is leg pain that starts during walking and improves with rest. Over time, if left untreated, this condition can lead to serious complications like ulcers, infections, and even risk of amputation. That's why cramps that consistently appear after physical activity and go away with rest deserve special attention. They may not be simple muscle spasms, but rather a warning that your blood flow is compromised. 8. Neurological disorders. Neurological disorders are among the most complex and challenging causes of intense and recurring muscle cramps because they involve direct impairment of the central or peripheral nervous system, which is responsible for the precise control of muscle activity. In these cases, cramps aren't isolated events, but part of a broader, progressive clinical picture. For example, in Parkinson's disease, in addition to the typical tremors and muscle stiffness, many patients report painful cramps, especially in the legs and feet, which may occur during rest or at night. In motor neuron diseases, such as amyotrophic lateral sclerosis, ALS, cramps become frequent and severe, accompanied by muscle weakness and loss of muscle mass, as the nerves that stimulate the muscles gradually deteriorate. Another important group includes polyneuropathies, which involve damage to multiple peripheral nerves and can be caused by diabetes, alcoholism, infections, or nutritional deficiencies. In these cases, patients often experience tingling, burning sensations, numbness, and cramps, usually in a symmetrical and progressive pattern. There are also rare neuromuscular syndromes, such as multiple sclerosis or Guillain-Barré syndrome, that can trigger intense muscle spasms. The biggest challenge is that these symptoms often appear subtly and gradually, which can delay diagnosis. That's why when cramps are accompanied by other neurological signs, like stiffness, tremors, muscle weakness, or decreased sensitivity, it's crucial to consult a neurologist for a deeper evaluation. There may be an underlying neurological condition that requires specialized treatment. 9. Excessive physical effort and exposure to cold. Excessive physical effort and exposure to cold are environmental and behavioral factors that, although they may seem harmless, can trigger intense and recurring cramps, especially in people who don't take proper precautions before, during, and after exercise. During intense physical activity, muscle metabolism speeds up, and one of the consequences is the buildup of lactic acid, a byproduct of muscle contraction under low oxygen conditions. This acid irritates muscle fibers and surrounding nerves, causing pain, stiffness, and cramps, which can appear during the workout or hours later, especially during sleep. In addition, working out without proper warm-up, stretching, or hydration further increases the likelihood of cramps. Cold exposure causes a different kind of problem. It leads to vasoconstriction, or narrowing of the blood vessels, reducing blood flow and oxygen delivery to the muscles. With less oxygen available, muscles become more prone to fatigue and involuntary contractions. That's why many people experience cramps at night, especially in air-conditioned rooms or on cold winter nights, even without physical exertion. Cold temperatures also reduce body sensitivity, which can mask early signs of muscle discomfort until the pain becomes unbearable. So if you work out regularly or live in a cold climate, it's essential to adopt a routine of warming up, staying hydrated, and protecting your body from the cold. Making these simple adjustments can significantly reduce the frequency of cramps and improve both physical performance and overall well-being. When a cramp is dangerous, 2 warning signs. Some cramps are a sign of a medical emergency. You need to seek help if 1. Muscle pain lasts more than 10 minutes. When a cramp goes beyond the usual limits and the muscle pain lasts for more than 10 minutes, even after stretching, massage, or relaxation attempts, it's a clear sign that something more serious might be happening and should not be ignored. Typical cramps caused by muscle fatigue, mild dehydration, or temporary strain usually go away on their own within seconds or minutes. However, when the pain stays intense and localized for a longer period, it could be related to more complex medical conditions, such as nerve compression. This compression may disrupt the electrical signals between the brain and the muscles, leading to ongoing spasms and chronic pain. Another possibility is a vascular problem, such as an arterial blockage, which reduces blood and oxygen flow to the muscles, prolonging the pain and making it harder for the muscle to relax. Additionally, severe electrolyte imbalances, like abnormal levels of potassium, calcium, or magnesium, can interfere with how nerve and muscle cells function, making the muscle contraction harder to reverse. In these situations, pain isn't just a nuisance. It's a warning signal from your body that something deeper is wrong and needs to be investigated with specific medical tests. If you've ever experienced this kind of prolonged pain, it's essential to seek immediate medical attention. Early treatment can help prevent serious complications and protect both your muscle and nerve health. 2. The pain is intense, but the muscle isn't contracted. When pain is sharp and localized, and it feels like a cramp, But when you touch the muscle, it's relaxed with no signs of tightness or visible contraction. This is a major red flag. That type of pain, which mimics a cramp but without the muscle actually tightening, may indicate muscle ischemia, a critical condition where the blood flow to a specific area of the body is partially or completely blocked. Ischemia prevents oxygen and nutrients from reaching the muscle tissue, causing cellular distress that leads to severe, often unbearable pain, even while resting. Unlike regular cramps, which usually improve with movement, massage, or hydration, ischemic pain persists, worsens with activity, and does not respond to typical relief methods. So, if you're feeling intense pain that resembles a cramp, but the muscle feels soft, limp, or normal to the touch, don't wait. Seek emergency medical care. You could be facing a vascular emergency that carries the risk of irreversible muscle damage if not treated in time. Avoid miracle cures and self-medicating. When faced with the discomfort of cramps, many people immediately turn to quick fixes like potassium supplements or over-the-counter painkillers. However, this approach is often ineffective and can even be dangerous. For example, taking potassium without knowing your actual blood levels can be extremely risky, especially for people with kidney dysfunction. Since the kidneys are responsible for filtering out excess potassium, a malfunction in that system can cause potassium to build up in the blood, leading to serious arrhythmias and even cardiac arrest. Likewise, frequent use of painkillers to mask the pain can damage your liver, hide important symptoms, and even cause anemia, especially when used without medical supervision. That's why the smartest and safest approach is to find the real cause of your cramps. Instead of treating the symptom as a one-off issue, look deeper to understand what's behind it. Simple lab tests like electrolyte panels, sodium, potassium, calcium, and magnesium, kidney function tests, blood sugar checks, and hormone profiles can uncover hidden imbalances or silent conditions that show up as muscle spasms. With an accurate diagnosis, treatment can focus on the root cause, avoiding complications and offering long-term relief. In short, don't hide your symptoms with quick fixes. Treat the root of the problem with professional care and responsibility. Cramps aren't just a minor inconvenience. They could be your body's first warning that something more serious is going on. Ignoring the signs might cost you later. Take care of yourself and pay attention to what your body is trying to tell you. If this video helped you better understand the possible causes of cramps, leave a like, subscribe to the channel, and share it with someone who needs to hear this message. It may seem like a small gesture, but it could make a big difference in the life of someone suffering in silence. Now tell me in the comments, do you get cramps frequently? Which of these causes do you think might be behind your case?